functions. In Europe, 179 million citizens live with neurological disorders such as Alzheimer's disease, Parkinson's disease, multiple sclerosis, and others. In our meeting today, we welcome Professor Claudio Bassetti, representing the European Brain Council. The European Brain Council is a network of key players in this area, aiming at promoting research in order to improve the life of people living with neurological disorders. I will give the floor to Professor Bassetti for his intervention, after which we will have a session of questions and answers with the members. Professor Bassetti, the floor is yours for 8 minutes. And please let us know if you want to speak. Thank you.
Dear Chair, dear members of the House, I'm sitting here, as you heard, as Vice President of the European Brain Council and past President of the European Academy of Neurology. As a physician, but also as a professor of neurology, I spent my entire professional career in taking care of patients with neurological disorders, in speaking with families, relatives of patients, young and elderly, and adult patients with neurological and brain disorders, and making research to understand better how to diagnose, how to treat, but also how to prevent neurological and brain disorders. For these reasons, I'm truly honored but also thrilled about the opportunity to share with you the considerations that led EBC and the associated societies to recognize, together with the WHO, neurological and brain disorders as a public health priority. I'll try in the next 8 minutes to show you what is the evidence for the very high increasing burden of neurological and brain disorders overall, but also a glimpse of hope why we can believe today that some of these disorders can be prevented and how we can also promote brain health. Next slide, please. EBC speaks with one voice on behalf of the associated societies. I will not read all of them. I want just to stress the fact that there are clinicians involved, there are researchers involved, and there are patients involved. So we speak in one voice with one message, but we speak on behalf of many people behind. Next slide. Now, the burden of brain disorders in general. Recent data that have been published in prestigious journals have shown that 1/3, if not even up to 43% of the entire population suffers today of a brain disorder. Not all of them are deadly diseases such as dementia and stroke. We're talking about headache, we're talking about anxiety, but the figures are incredible. And today, altogether, brain disorder, neurological and mental disorder represent the #1 cause of disability in the European population. Next slide. This slide shows you the evolution of the burden of brain disorders, and here I want to make the point that we consider neurological and mental disorders as two sides of one coin. This slide shows you the evolution of the disability over the last 30 years in the world, and as you see, there have been a doubling of the disability. Why? Because of aging. Obviously, some of these disorders are age-related, but also because there have been societal changes. We know that the environment plays a role. We have heard about smoking, the drugs play a role, and many other factors. And last but not least, COVID has also increased the burden of mental, neurological, and overall brain disorders. So the burden is really increasing. Next slide. But we do have now increasing possibility to prevent brain disorders and actually to promote resilience in the population to face brain disorders, neurological disorders, and mental disorders. This is a slide which shows that the WHO has come up very recently with a definition of brain health, which will I not read. I think one of the key messages of this new definition, which came out in 2022, is that if we want to do something, it was mentioned in the previous discussion, we have to start at birth with young subjects, with adolescents, and should not start thinking about preventing brain disorders at later age, when maybe the first signs of dementia or other neurological disorders are appearing. Next slide. Now, we know a lot about what we could call the determinants of brain health. So in this scheme, you see a brain and you see 3 levels of interventions that we can discuss, and we actually do already in our public health approaches and also as clinicians to promote brain health and to prevent brain disorders. We can work at individual level in promoting good sleep, social contacts, healthy diet, physical exercise, etc. The next stage we could call the intermediate stage here, where we want and we can prevent the development of brain disorders through interventions on the risk factors. Some of these are unspecific, they are good for health in general. Some of them are specific for the brain, hearing loss, depression, head trauma. And finally, you have the 3rd level of intervention, which we could call the public health intervention, where the society and the stakeholders like you can do something in promoting education, in promoting research, in promoting the care for our environment, etc., etc. Now, I would like to stress the fact that some of these factors are well established scientifically, some of them are hypothesized. So we need more research. So today, up to 50% of the phenomena, dementia is well characterized, but there is 50% of the phenomena which is still unclear. The same for stroke, the same for mental and disorders and other neurological disorders. So this slide should not give you and give us the impression we know everything. There is more research to be done to do more to prevent brain disorders and to promote brain health. The next slide. Now, these considerations have brought the WHO to promote 3 initiatives. There is an international momentum, we could say, on brain health, one on mental health and mental disorders, one on dementia, and the most recent one just recently launched, the one on epilepsy and other neurological disorders. Now, we promote as EBC an overall comprehensive approach of all these disorders, just because we have one life and one brain, and during our course as human beings, we go from one disease, if you want, to the next one, and we need to have a holistic and intersectorial and coordinated approach to promote brain health across the life course. Next slide. Now, as you probably are aware, there is a growing European momentum also at other levels. The EU Partnership for Brain Health is about to start. There are initiatives to work on mental and neurological disorders together at European level, and we will work across and along the EC priorities, competitiveness, skills, and education. Next slide. So what we are calling for, we are calling you for supporting the idea of creating an integration on brain health with a corresponding working group and also coordinating plan on for the brain at European level. And you see that we have on our side many organizations, again, of clinicians, including pediatric, adult and geriatric clinicians. We have researchers from all over the field of brain disorders. We have patient organizations, we have industry, and we have other stakeholders. Last slide. Well, we have upcoming milestone and meetings, and I'm happy to answer any question you may have on this very important public health priority, the burden of brain disorders, but also the chance to prevent them, to promote brain health, and actually promote resilience in our population. Thank you for your attention.
Thank you very much. And I will start by giving the floor 2 minutes to Sokol.
Thank you very much. Thank you, Professor, for being with us today to speak about this very, very important topic. I'm a bit sad that half of the room has left after the previous topic, because of course smoking and smoke-free environments are important, but I think brain health is as important as the topic that's discussed before. Maybe not that politically attractive, but I think that this is precisely the reason we have to change. So this is something that we have to change. We have to raise awareness of the issue of brain health. I would like to highlight 2 numbers. So first is The second figure that I would like to highlight is the fact that, as you said, that around 50% of cases of issues related to brain health are still undetermined, which means that we have an enormous potential for growth. We have enormous area to research to really cover all of this, so that we know that we can set the right diagnosis, that we can treat people. So these are precisely the reasons why I strongly advocate also here in the Parliament for the creation of this intergroup, because unfortunately this topic is still not as visible as it should be when compared to other topics related to public health. Of course, EU has limited competences in the area of health, so we cannot harmonize national healthcare systems, etc. But I think we can do a lot. I think that we have a lot of possibilities to provide financial incentives for research, to prioritize research on brain health also in programs like Horizon, similar like we did with cancer. So I believe that we have really a lot of possibilities to act, to improve things on the European level within the competences that we have, and definitely I support this approach. So not just a question, but I just wanted to give some comments on this. And again, I'm glad that we have the possibility to emphasize the importance of this topic and to raise the visibility of it here in the European Parliament. Thanks.
Thank you so much. Mr. Andreakakis.
Thank you. Thank you, Professor, for a very excellent presentation. Excellent. In 8 minutes to present the whole picture. Continue in Lithuania. Aš norėčiau, Professor.
Professor, I would like Thank you. Professor, I would like to ask you 2 questions. One of them is that when we speak about neurological mental health in general and the necessity to have a strategy in this field, this topic is very closely linked to the huge problem that is the lack of specialists. The lack of specialists in all chains, neurological specialists, psychiatrists, psychologists, and so on and so forth. How do you see this problem? Because it's a ticking bomb in the European Union. In 5 years, we'll face more problems, and we won't have enough people working in this area. And my second question, we've got a reference center system, a system of reference centers in Europe. And there are centers which deal with rare cancers, other rare diseases, pathologies which are related to cancer, brain cancer and other diseases. However, we do not have a strong network that could connect academic centers of neurologists, psychologists, psychiatrists into one network that could help us much more efficiently to face the problems, to tackle the problems that we face, because we've got the lack of specialists, and because of that we need excellence centers and more efficient functioning of those excellence centers so that they could communicate better and help us tackle those managerial, basically, problems which are numerous in our hospitals dealing with neurological patients, neuropathologists, and so on and so forth. Thank you.
Thank you so much. And Veruga?
Thank you very much, President. Thank you, Professor, for excellent presentation. I'm here. And you've correctly mentioned several things that I would like just to repeat. First of all, that we have to have a holistic approach. We have to start early, because later on those problems are becoming a huge burden. This not just the health, but also the social and economic burden, because when we talk about the dementia, the young people have to stay at home and they are going out from the labor market, because if the systems are not in place, somebody have to take care of the older people who have dementia. And I would like to ask you one question, because you have mentioned that we have to start early. And we don't know some reasons for some diseases, like 50% are unknown. What are the risk factors for the development of some disease? But there are problems that we know the reasons and could be 100% preventable. And one of the problem is the fetal alcohol spectrum disorders. Those problems are 100% preventable, and when happens, they are irreversible. So we don't have treatment for the damage that is done to the brain. So in your point of view, in your perspective, what could be done and why this problem is somehow neglected and unseen when we talk about the brain health? So thank you very much.
Thank you so much. I will allow myself 2 minutes and share with you a story. My daughter, now 40, when she was 33, she was hit by a virus that went into her brain. And in a country like Denmark, there wasn't really any help to get. We tried a lot, and at the end of the day, I had to spend many, many hours on Google, and I found out what the problem was, and then I found out that in Germany, in Sweden, this was recognized, and that was actually a way forward. Why do I tell you this story? I tell you this story because it is an example of where we exactly in Europe can do much more together. And we can make sure that we actually use the competences that we have together in areas that are rare, and rare diseases is an obvious place. This is another obvious place where we do not know enough, and we can and should do a lot more together. And I think exactly the recommendations from Andrea Kiatis are very clear and very good, that some of the networks that we have should be encouraged, and perhaps we should even work further in some of the areas where this is just too obvious. So let just be a personal note and an encouragement. Thank you. And then we will go on to the next speaker, which is my colleague here, Tilly. Thank you.
Thank you. Thank you very much, Tina. Dear Chair, dear Professor Bassetti, thank you very much for this presentation. And I agree also with my colleague Sokol that we don't speak enough about neurological diseases. I would like to focus on prevention across the entire spectrum. First, secondary and tertiary prevention. Secondary and tertiary prevention are vital in neurological health as they focus on early detection and slowing disease progression and managing also the symptoms in order to improve quality of life. In Europe, early diagnosis of conditions like Alzheimer's, but also multiple sclerosis, is often delayed, and access to rehabilitative services can be inconsistent across the countries. So what, in your opinion, could be done really at European level to enhance the EU capacities with regards to secondary and tertiary prevention? Second point is about primary prevention, and especially the impact of the environment on neurological health. We know that heavy metals, pesticides, air pollutants contribute to neurological diseases such as Parkinson, Alzheimer's. Evidence highlights increased risk due to occupational exposure and geographical factors, especially with vulnerable populations like children facing heightened risk. Over the last few decades, there has been a striking increase in the prevalence of neurological diseases, and your presentation showed it. At the same time, Europe's largest ever screening program for toxic chemicals, the European Human Biomonitoring Initiative, so a 5-year program with 116 governmental agencies, labs and universities, has found that citizens are exposed to multiple hazardous substances above levels that could cause serious illnesses. The negative relationship is supported by evidence. So in Europe we see a growing, and that's my question, a growing opposition to strengthening corporate accountability rules on chemicals, pesticides and air pollutants. But is there another way to prevent toxins in environment from harming people?
Thank you so much. And before we leave the floor for the first comments, please, Haskamp.
Yes, thank you, Chair, and thank you for coming, Professor. I have, in addition to what Tilly said, some environmental questions. I would like to focus this question on the link between chemicals, notably pesticides, and neurological health. There are strong and growing indications that persons with a past history of working over a long time with chemical substances, such as growers who work with pesticides, are at a greater risk of developing diseases that damage the nervous system, such as Parkinson's disease, Alzheimer's disease. And the same is true for people who live near the fields with high pesticide use. We see a very worrying increase in the occurrence of Alzheimer's and Parkinson's disease in the Netherlands, and especially in rural areas with intensive agricultural use. And already in 2021, the Dutch Institute for Public Health and Environment, IVM, commended improving the relevant data requirements and testing guidelines. That's because the data requirements for active ingredients of pesticides do not include standard information regarding effects on the nervous system. So the lack of adequate system and testing has huge repercussions. And take, for instance, glyphosate, a very controversial herbicide that has been approved for use in the European Union for another 10 years, despite uncertainty over the risk of neurodegenerative diseases. There are urgent calls from scientists, and I just want to ask you, dear Professor, how do you assess the relation between the use of chemicals in agriculture and the rise in neurological diseases, and how could we better assess and how could we better contain those risks? Thank you.
Thank you very much. And please, Professor Bassetti.
So thank you very much for the overall appreciation of my call, and I'll try to address, if not all, at least the most important points you raised. Maybe the first statement, 43%. In fact, please excuse me, 1/3 of you has now a neurological or mental problem, whether you are aware of or not. Now, when we say 43%, we include, obviously, not only the very severe ones that we have heard about, dementia, stroke, Parkinson's disease, but also very frequent disorders, such as sleep disorders, such as headache, such anxiety, which are drivers of the burden and actually have an influence on the long-term brain health outcome, including being risk factors, for example, sleep disorders for dementia. So when we talk about the very high prevalence, please be aware that we are not talking only about the well-known neurodegenerative, devastating disease, but of very frequent disorders that have an impact on brain health and the way we function. Second element that was raised. Yes, you're right. It's not only about brain disorders, it's about the brain. And I would like to say something that is trivial to you. The brain is the organ that allows us today to interact. This is the organ that allows us to realize our potentials as individuals. This is the organ that allows us to be social individuals, but also to function as a society. So I cannot but support the statement. Promoting brain health is promoting brain capital. So this is the organ that we should invest in. And the last thing that we have is our brains that will allow us to create a better society and a more equal and more fair society. So please, if we talk about brain and brain health, it's not only about brain disorders, it's also about what we can do with our brains, and we need to use our brains better than we all probably do, or at least not all the time. Second statement, second question. Why neurologic and psychiatry? Well, I tried to make, in the very short presentation, a call for considering the two as two sides of one coin. We all know that anxiety, depression are categorized in the category of mental disorder. We know that stroke and dementia are categorized typically in neurological classification, but eventually these are all brain disorders that are arising in brains of individuals that interact with the society. So psychosocial factors, psychological factors, the environment, the society plays a role in both. So we need to take care of both together, even if then specific intervention will be promoted by specialists. Now, there was a big question about the working force. Yes, we are facing actually an increasing burden. We will not be able, not even in the very well advanced countries in Europe, to face this increasing burden. So what do we need to do? You stress the importance of education. This is what I think we need to do. We need to promote new health professionals that actually will be devoted to promote brain health and prevent brain disorder. We will not be able to catch up with this incredible avalanche of brain disorders if we count only on the specialists that intervene at the late stage. So we need to prevent those things, brain disorder, we need to promote prevention at an early stage. So we need to rethink education and promotion of brain health. Now, the next question was the complex and very, obviously very articulated question about secondary and primary prevention. I fully agree that when we speak about secondary prevention, it is related somehow also to early diagnosis and early interventions. I mean, for some disorders to intervene early is fundamental, and this is obviously very important for diseases such as stroke, dementia, and others. However, and I want to stress this fact, it is not only about neurodegenerative disorders, as important, as devastating they are. We need to start early in promoting brain health as a whole, because we actually decide about our brains, and somebody said before, when we are 60 years old, we decide already in younger age how we sleep, what we do with the use of nutrition, what is about chemical and the environment. So we decide about our brains, the way we interact, the media. It was made a point in the slide, it was not mentioned today. This is very toxic too if we overuse the media. So I think this is about secondary prevention. So now about the primary prevention, I've shown the slide. As I mentioned, we do many of these factors, some of them are unknown. I would like to stress and join you in the statement, environment is important. There are climate changes that have a fundamental and major effect on mental health, and we believe also on brain health, neurological, mental, but this is completely understudied. At my university, I'm dean of a medical university, we are now creating a chair devoted to the study of the effect of climate change on brain health. Just to make an example, there are other initiatives in Germany, there are other in the UK. Chemical substances, yes, this is well known. It is well established for some neurodegenerative diseases, I would like to say also for neuromuscular diseases, but it's also understudied. So the impact of the environment, and you asked specifically about chemical substances, is certainly not well studied, not well enough. However, I would like to stress the fact this is one of multiple effects. I mean, in the slides I've shown trivial things, treating of hearing loss, treating eye disorders in a subject that is becoming demented is very fundamental. These are things that we can do that are not done. So there is I would say, a double message in what I'm trying to say. One is that we should at least do what is known, and there is a lot that we know, but we should invest in research because you mentioned 50%. It depends on the diseases, but there is still a lack of knowledge and we need more research on the determinants of brain disorders. Rare disorders. Yes, they are rare, but if you put them together, it's 8% of the entire population. Now, the problem of rare disorders is that being rare, there is even less investment in research and there is even less investment in clinical approaches. And this leads back to the question of centers. I do believe that it would be a great initiative to create centers that, one, work together in the field of neurology and psychiatry, adults and young, and we should take care better of creating cross-linked knowledge around the rare brain and neurological disorders. So thank you very much for these questions, and I'm glad to approach the next round of questions.
Thank you. I have got 3 speakers, Ripa, Vasilevsky, and then Moratti. And the last one here? Super. Okay, let's go on to Ripa.
Thank you very much. Thank you very much for your presentation. I'm here. You talked about mental disorders that can be prevented, and we should make our society resilient. And you also said that we should start at a very young age, and we have to intervene early. What is happening in the US? 33 US states initiated a lawsuit against Meta. Meta is accused of deliberately designing platforms like Instagram and Facebook to be addictive, especially for children and teenagers. Features like infinite scrolling, frequent notifications, algorithm promoting constant engagement are cited as tools used to manipulate young users. The states argue that meta-addictive features and practices contribute directly to a national youth mental health crisis. Alleged impacts include increased rates of depression, anxiety, suicidal ideation, and interference in the daily activities such as school and learning. So, how do you see this? You didn't mention it in your presentation, and I would like to hear from you. Shouldn't this be something that should be of concern also for us at the level of the European Union? And how can we tackle this problem? Thank you very much.
Thank you. Over to you, Vlad.
Good morning. Thank you very much for the presentation. Really amazing, encompassing lots of really relevant stuff. I would like to ask you to address 2 issues. One related to our younger population, and specifically to drug abuse, and one related to dementia. Now, for both of them, I would like to ask you if there are any best practices on the policy level, but also on a treatment level, as in specialized centers in Europe. Where are the places, where are the people that we can look at to learn, to see what worked as a pilot and what can be expanded? I mean, the problem with the dementia problem, if I'm not mistaken, if my figures are right, all the big countries in Europe already have around 1 million or over 1 million people with dementia. France, Germany, Spain, Italy. In some countries, like the country I'm coming from, Romania, this is not even acknowledged, and there are hardly places where these people can get help. So I'm wondering, where are the best practices? What we can learn, that we can learn for kids that have abused drugs, and for the older population. And for the older population also, do we have enough resources for an aging population and for more people? Mr. Andriukaitis approached it earlier, saying we already have a shortage of neurologists, but of course the entire, you need a team for that, so care personnel and so on. Where are we going, considering the numbers, and what do we need to make sure over the next couple of years?
Thank you, Vlad. And finally, oh, sorry, not finally, Moratti and then Anderson.
Thank you, Professor, for your presentation. Thank you for giving us your views on the importance of education and strengthening the research, giving the terrifying numbers that you gave to us in terms of cost and number of people affected by brain problems. So my group, I'm from Forza Italia and EPP, so I will strongly recommend my group to support your intervention on creating an intergroup on brain health. I would like to understand whether we could, in your view, we could also have brain and mental health together, also following the point that we had a recommendation from the Commission, so the 20 flagship on mental health project. And my question is, in my country, we have some concern about the functioning of the European Reference Network on genetic neurological diseases, which we believe are not functioning as they should be, and they are not financing as they should be. So my question is, what do you believe on this? Would you believe that we could increase and have a better coordination on these topics? Thank you, Professor.
Thank you so much. And Anderson, and then Sokol has asked for 1 minute.
Yeah, thank you. I listened to you very, very carefully, and thank you for the presentation. I was wondering if you could elaborate a little bit on what impact, if any, did government actions, imposition of restrictions and measures, and the overall handling of the entire COVID crisis had on mental health, on the citizens? And are there any issues that you would point out to how they should have dealt with that differently? Or would you agree it was pretty much what had to be done, and there was no mental health issues in the citizens? Thank you.
Thank you, and then Sokol.
Yes, thank you. I just wanted to take the floor again to make references to something that was said, I think, which is very important, and that is the pooling of knowledge, the problem of rare neurological conditions, building centers of excellence, etc. So, and that's a problem, because in many member states, like smaller member states, really do not have the capacity to treat many rare neurological conditions. But in the EU, we have two tools already at our disposal which are not working. One is the European Reference Networks that was mentioned. That is very important, so we need stronger funding for that, much stronger funding that we have now, and I think we should all support that. And second is the cross-border rules on cross-border healthcare. So we have the cross-border healthcare directive, we have social security coordination regulation, but now they are not really working, they are not functioning. And the main reason for that is that you really need to be a health law expert to understand as a patient what your rights are. So I think that we can use this forum here to actually call and put pressure on the European Commission to start with the revision of these rules, because what we have now is obviously too complicated, not working, people are not aware of their rights. So I think that definitely, we can all find a consensus that we need the revision of these EU cross-border rules as soon as possible. So this is just what I wanted to say. Thanks.
Thank you very much, Sokol. I think that echoes a lot of what people have said. And final remarks and answers to the questions. Thank you.
Well, thank you. Very important point. So one question was about prevention and resilience. I think you made the important point. I think there is a difference between the two. The prevention in the context of neurological and mental disorders has a connotation which asks for a motivation of the subject to take action. And this may lead then to complex mechanisms that may indeed foster then a passivity of the subject towards, what needs to be done. Whereas the resilience concept has a more positive connotation. So it promotes actually what you can do to prevent something rather than taking use of something that is offered to prevent. I'm thinking about actions or drugs. So I think we need both. This is what I'm trying to say. Now, the second point you made was alluding to the problem in the United States. I think that it was in the drawing, but maybe not stressed in the presentation. We do have a problem with media overuse. And you stressed, and this has been shown scientifically, the fact that language cognition are in young subject reduced or impaired by the overuse of media. So I do believe that, yes, if we want to promote brain health, we need to address this topic. Now, I would like to say that media use is per se detrimental, but media use is also related to sleep loss and sleep disorders. And you mentioned also with mental problems. So I think we need to see the whole in a context is obviously you need targeted interventions, but very often these problems come in a cluster, you know, social isolation, media overuse, sleep loss, and eventually mental disorders. So I think the topic is very complex, and I cannot but agree about the drug and drug abuse, which is obviously a problem that we should address. There was then the question about the importance of intervention in young population, but also the topic of dementia. And I would like to say that the recent consortium work published in the prestigious journal Lancet has identified at least 10 factors that can be addressed in trying to prevent dementia. Many of these factors have been shown in my slide: hearing loss, slight loss, hypertension, head trauma. So this is why we are working also with neurosurgeons at the EBC. And many of these factors are accumulated along the life course. You know, remember the history of Cassius Clay, Muhammad Ali, who developed dementia and Parkinson as a result of recurrent head trauma. So again, what I stressed already before, if you want to prevent dementia, you should not start at the age 50. And only targeting specific, what we do obviously in clinical trials and also in clinical practice, specific elements of the prevention, but we need to see this as an accumulating risk that starts in youth. I think you made an important point. I think the future will need a concerted and integrated approach, which must be multidisciplinary and cannot be just linked to the presence of neurospecialists. We need other health professionals that will serve also as fostering preventive and resilience promoting approaches. Now, one point that I may have not stressed enough is that we need more research, and there is a discrepancy between these huge numbers that I've shown about the prevalence. And when we talk about burden, I would like to say it's not only about prevalence of mortality, morbidity, disability, it's also the stigma, the sufferance of the patients and of the families. This is something that is sometimes difficult to measure, but when we talk about burden, it's a complex burden. And I don't have to explain you that having dementia, having depression, having schizophrenia has a different impact as a stigmatizing disorder as, let's say, a bone fracture or maybe other conditions that are also very frequent. So I think there is a discrepancy between the burden, the figures that I've shown, and the investment in research. This is why we are so behind in having targeted and specific intervention for specific neurodegenerative and other neurological disorders. They are complex, but tumor is also complex. Cardiovascular disorders are also complex, and we see that what has been invested in the last decades have had a major impact on the reduction of the impact of some of these disorders. The brain is just lagging behind because of the complexity, but because also the research that has been invested has been limited. Now, there was then the other issue about whether brain and mental health should be put together. Absolutely. Absolutely. We cannot separate. I mean, in 1850, Professor Griesinger in Zurich said, all mental disorders are brain disorders. This does not mean that we have only an organicistic approach. We need to take care of the society, the psychosocial factor, the interaction of the subject, his brain, and the society. But this is the same for any disorder and also for neurological disorder. And also there is a huge comorbidity. Every third patient with dementia, with stroke, has depression. Depression is a risk factor for dementia. So they are intermingled. So we need to have an holistic approach. And when it comes to targeted approaches, obviously we will become very specific. Parkinson's disease from schizophrenia is disease. But when we think about prevention and overall approaches, we need to think together. Now, it's not in my function and maybe not the right place to judge on how the European reference centers work. I may not have also all the data to make a specific comment, but it is clear that it's underfunded. It is clear that it's underfunded. I happen to know a little bit about what is there because I've been promoting in my career also a very specific disease, which is narcolepsy, which is a rare sleep disorder, which is really underdiagnosed. By the way, Holland, I don't know if somebody's from Holland, has been a fantastic country in promoting the care of these disorders. So I think they are underfunded. COVID. capture some criticism in the question, and I cannot but join you. I think that COVID has taught us many things. One is how important social contacts are for our mental and eventually brain well-being. It has been it's been fostering an increase in mental disorders in the youth and also in the elderly population. And the second point is that COVID and post-COVID syndrome is a perfect example how it is difficult to separate between mental and brain disorders. We know that some patients with post-COVID syndrome have a brain damage. We know that some of them may not have primarily a brain damage, but they have mental problems, psychosocial problems. And in a single patient, believe me, I see this patient, it's not always easy to say, this is a mental problem, this is a brain problem. We need to have a multidisciplinary approach, and we need to have an open mind. But COVID told us that social contacts are very important. So when we think about the future, we will have to balance the need of restricting and the importance of keeping social contacts. And in my slide, this was one of the key elements that each of us can do to promote its own brain health, nutrition, physical, mental activity, social contacts.
Thank you very much. And because everybody has been sticking to the speaking time, we actually can have space for two speakers, because this is obviously a very interesting subject. So please, yes, Troshu and then Kulja.
Merci, Madame la Présidente.
Thank you, Chair. Professor, I support your global strategy and your multidisciplinary approach to cerebral issues. But there's a new element in the debate, and this is about a dysphoria. It's a kind of suffering. And I'd like to point here to Sweden, which was one of the first countries to put forward gender-blocking drugs. This country is now looking into the dangerous secondary effects faced with the distress in the initial phases of the process. Now, figures show that the number of young patients asking for a gender transition suffer from other diseases like autism, depression, anxiety, and PTSD, and those numbers are quite high. So I would also like to use this issue to so that we can respond to this issue of transgender. We risk becoming a health scandal because when it comes to transgender, changing sex is often irreversible, and this can cause further problems. We are hearing feedback of experiences from countries who have been on the front line of going towards and allowing transitions, and we're now hearing feedback from them. Thank you.
And Kulja, for the final comment.
Thank you very much. I would like to ask you about the support, the development and usage of new AI solutions that can detect early signs of neurological diseases, either by biomarkers or by voice. 13 years ago, as a medical student, I was involved in the development of a voice-based detection system that could detect depression and estimate its severity by voice. Since then, these solutions have improved a lot. These are non-invasive, painless diagnostic tools, and can be of enormous help in early detection and in preventing or delaying serious consequences. I would like to propose to support the development and the usage of these new innovative tools to make the diagnosis and diagnoses as early as accurate as they could be.
Thank you very much. And this will mean the final comments from you, Professor.
Thank you for the two questions. I have to admit that about the first topic, I cannot make any specific comments. This is not an area that I'm an expert or I've been facing much as in my career as brain and neurological specialist, but it is for me obvious that these patients are facing major mental stress and eventually mental disorders. So without having a specific knowledge on the topic, I would second what you say and certainly encourage specific measures to do something. But please excuse me, I'm not an expert on everything, and this specific topic, I cannot really make any more specific comments. Now, the next topic I feel more comfortable about because I join you. I do think that the use of new, as we call them, nearables, but also wearables, things that you can carry with you, as we all do with our watches that typically have digital monitoring in place with us, but also nearables that are not with you but are in the environment, are indeed digital approaches that will then use artificial intelligence to then give us information about our behavior, about our cognitive function, about our sleep. And there are fantastic new developments that can, for example, record your voice, and out of the recording of your voice tell you how you are you doing cognitively, how are you doing emotionally. I mean, when you call at home with your wife or your son, you know immediately how he feels. So how does your brain understand this? Well, now we have machines that can help us to extract information about the voice and the use of the voice, the specificity of your language in detecting cognitive mental. So I think this is a new era, and I think we will need new ways to use this technique to help us understanding how mental neurological disorders arise and how they develop. The question will be how much we want to intrude. There is a liberty that we need, obviously, of the single individual that need to be respected. And this is a topic in itself. But yes, I mean, new techniques and the use of artificial intelligence will help us and guide us also to take care of these huge amounts of patients which will not be able to be taken care just by single doctors in the future.
Professor Bassetti, I want to thank you. It has been really, really interesting, and I want also to thank you, colleagues. And I cannot do anything else but share with you that, you know, I'm wearing just an ordinary watch. My friend wears a watch with all the information, so when we wake up in the morning, you know, I say I've slept very well, and my friend looks at the watch and says, oh, I also slept well. And perhaps there is also something there to think about. Anyway, thank you very much, and now I will leave the floor to Fragos, and just thank you and applause.